So,
કનેક્ટર તમારું કદાચ નહીં.
rates of cancer,
આ તમારું લગાવેલું ને, તમારું તો આપી દીધેલું પાછું.
rates of occurring of cancer in young is on the rise. And the media and the social media are flooded with reports of increasing cancer at an early age. What are the reasons for these incidences? I invite Dr. Amit Gupta on the dais to enlighten us about this.
He is going to talk on is early onset cancer a global emerging epidemic and what can be done about it. He is an oncologist practicing in Tata Hospital, Mumbai. Since last 4 years practicing as freelancing oncosurgeon in Surat, majorly attached to Nirmal Hospital and all other hospitals of Surat. He has a special area of interest in breast, head, neck and open abdominal oncosurgeries.
Yes, sir, please proceed.
Thank you everyone for this wonderful opportunity and sparing your time on this beautiful Sunday afternoon for a topic which is close to everyone, I think, and which is an emerging topic. Is early onset cancer a global emerging epidemic and what can we do about it? So before we start the topic, just a brief intro about myself. This is me, my wife, Dr. Anamika. She is a microbiologist, and my son. My MBBS is from GMC Surat. My MS General Surgery is from BJMC Pune. Then MCH from Mumbai, and now practicing in Surat since last 4 years. So ये सबको पता है कि मोस्ट कॉमन कैंसर्स क्या क्या है. तो बाय जेंडर इफ़ वी सी, तो मेन के अंदर दीज आर लिप, ओरल कैविटी फर्स्ट, second lung, stomach, colorectal and esophagus. And in women, the most common is breast cancer, followed by cervix, then ovary, then mouth cancer and lastly is colorectal. Now, अभी आज का टॉपिक कि इस अर्ली ऑनसेट कैंसर, मतलब यंग एज में जो बोलते हैं लेस देन 50 ईयर्स में वो कैंसर सच में बढ़ रहा है, तो येस. सो दिस इज़ द डेटा, ये 10 साल पहले का है. इन 2002 एंड 2012 के बीच में जो कलेक्ट किया था ग्लोबोकॉन के अंदर, तो उस टाइम पे ही ब्रेस्ट का कैंसर जो है इट वाज ऑलरेडी 0.4% इंक्रीज्ड. अगर सपोज 100 में से 10 लोगों को कैंसर होता था, तो उस टाइम पे 100 में से 14 लोगों को कैंसर होता था. सेम फॉर हेड नेक. 100 में से अगर 30 लोगों को होता है, 10 लोगों को होता है, तो इट हैज़ इंक्रीज टू 3.9 टाइम्स. तो इट इज़ 39 लोगों को होता है. सेम, तो सेम गोज़ फॉर इन कोलोरेक्टल ऑल्सो, इट हैज़ इंक्रीज 2.9 टाइम्स. एंडोमेट्रियम 3.4 टाइम्स, किडनी 3.9, लीवर 1 to 1.5 to 1.5 टाइम्स, गॉल ब्लैडर 4.3 टाइम्स, बाइल डक्ट 6.6 टाइम्स, पैनक्रियाज 5.7 टाइम्स, प्रोस्टेट 3.2 टाइम्स, स्टमक 0.6 टाइम्स एंड थायराइड 0.2 to 1. तो आप ये सभी कैंसर देखोगे, ये सब कैंसर है, उनका इंसिडेंस पहले ही 10 साल पहले ही वो अर्ली एज में ज़्यादा होता था. तो दिस द एज ग्रुप वॉज बिटवीन 20 to 49 ईयर ओल्ड. अब इसके अंदर द न्यू इमर्जिंग रिस्क फैक्टर्स, सब लोगों को पता है कैंसर के जो मेन रिस्क फैक्टर्स होते हैं, दे आर टबैको, देन अल्कोहल, स्मोकिंग, बाकी ये सब. बट ये जो अभी नए नए जो रिस्क फैक्टर्स आ रहे हैं जिनकी वजह से यंग एज में कैंसर हो रहा है, तो वो कौन से हैं? तो एविडेंस इट सजेस्ट एन इटियोलॉजिकल रोल ऑफ रिस्क फैक्टर एक्सपोजर इन अर्ली लाइफ एंड यंग एडल्टहुड. Increased use of screening program has contributed to this phenomena to an extent, but a genuine increase in the incidence of early onset forms also seems to have emerged. ये जस्ट एक ब्रीफ इंट्रो है कि कौन से एक्सपोजर्स होते हैं टिल एडल्टहुड. सो देर इज़ ऑलवेज अ चांस ऑफ जेनेटिक ससेप्टिबिलिटी विच इज़ मोस्ट कॉमन. फिर ब्रेस्ट मिल्क बर्थ के टाइम पे ज़्यादा लिया नहीं लिया ब्रेस्ट मिल्क. एंटीबायोटिक यूज़. नवाए एंटीबायोटिक यूज़, क्योंकि एंटीबायोटिक से अपना गट का जो माइक्रोबियल फ्लोरा होता है वो चेंज हो जाता है. गट का माइक्रोबियल फ्लोरा चेंज होता है, उसकी वजह से जो अंदर ऑर्गेनिजम्स होते हैं, माइक्रो ऑर्गेनिज्म, दे रिएक्ट विद इन अ डिफरेंट वे विद द टॉक्सिन्स विच वी इंजेस्ट विद फूड, और उसकी वजह से कोलोरेक्टल कैंसर होने के चांसेस बढ़ जाते हैं. सेम गोज़ फॉर वाटर एडिटिव्स एंड पॉल्यूशन, एयर पॉल्यूशन फॉर लंग कैंसर. देन ओबेसिटी अभी हम बाद में देखेंगे कि ओबेसिटी नाउ हैज़ बिकम वन ऑफ द मोस्ट इमर्जिंग रिस्क फैक्टर फॉर ऑलमोस्ट ऑल टाइप ऑफ कैंसर्स. Increased height, decreased physical activity, increased sedentary lifestyle. Same goes for Western style diet, sweetened beverages. Sleep pattern change. अभी सब लोगों को लगेगा sleep pattern change और increased night light, इससे कैसे अभी कैंसर हो सकता है. बट इफ कोरिलेशन हुआ है ये सब के बीच में कि जिसके अंदर भी कैंसर हुआ है, अर्ली ऑनसेट कैंसर, उन लोगों के अंदर स्लीप पैटर्न चेंजेस आर देयर, इंक्रीज नाइट लाइट इज देयर. सो येस डेफिनेटली इससे प्रॉपरली कैसे पूरा आता है पूरा वो तो टाइम लगेगा बताने के लिए. बट राइट नाउ व्हाट वी कैन से इज दीज आर द इमर्जिंग न्यू रिस्क फैक्टर्स फॉर अर्ली ऑनसेट कैंसर. डिक्रीज एज ऑफ मिनार्के, increased oral contraceptive use, decreased parity and decreased breastfeeding. So all these are the new emerging risk factors for early onset cancers. तो सेम अब now थोड़ा डिटेल में अगर हम लोग डिस्कस करें तो now there is changing alcohol trends now. Binge drinking, as we can see, there are a lot of binge drinking episodes now. Social drinking, it is a new norm. Underage drinking, that is also quite prevalent. Second goes for obesity. So the global age standardized prevalence of obesity in children and adolescent 5 to 15 years, it has increased from 0.7% to 5.6% in girls and up to 7.8% in boys. This was between 1975 to 2016. तो उस टाइम पे जो लोगों का obesity था इतना ज़्यादा, उन लोगों को अभी जाके कैंसर हुआ इतने साल बाद. तो yes, definitely obesity plays a role in early onset cancers. The other risk factor is physical inactivity and sedentary lifestyle. Occupational physical activity generally decreased, while leisure time physical activity generally increased. तो हम लोग देखते हैं बहुत बार कि पूरा टाइम ऑफिस में हम लोग बैठे रहते हैं, सब कुछ है, पर बाद में जब भी लीजर टाइम फिजिकल एक्टिविटी होती है, इट इज़ ट्रेमेंडसली इंक्रीज्ड. सो ऑल दीज ऑल्सो दे प्ले एन इम्पॉर्टेंट रोल इन अर्ली ऑनसेट कैंसर. एवरेज सिटिंग टाइम हैज़ इंक्रीज्ड इन द पॉपुलेशन. The other risk factors are reproductive factors. Average age at menarche, average age at first birth, global fertility rate which has decreased now, the prevalence of women who never breastfed, global use of oral contraception, it has increased, and increasing use of infant formula. Smoking, the increased teenage smoking, second-hand smoke, adult smoking is directly linked with early life involuntary smoke exposure in offspring. The other risk factor is diabetes. Then the other risk factors, these are Western style diet. What is a Western style diet? It is defined as a diet which is high in saturated fat, red meat, processed meat, sugar and ultra processed food, but low in fruit, vegetable, whole grain and fiber. Then comes our nutrition, lifestyle factors and antibiotic. These all influence the development of various chronic diseases through various physiological mechanisms including microbial alteration. Antibiotic use, which has been associated with certain cancer types, has increased in both adult and children in many countries over the past half century. Inflammatory bowel disease, an established risk factor for CRC, in which the microbiome has a major pathogenic role, has increased in adolescents since the 1980s. The same antibiotic use से inflammatory bowel disease के chances बढ़ जाते हैं और उसकी वजह से colorectal cancers होने के chances बढ़ जाते हैं. The early life microbiome is known to influence the development of immune system. Therefore, the tumor microbial immune interaction, they are an emerging research frontier which will likely provide novel etiological insights. Then these are all low penetrance variant. सब लोगों को लगता है कि बहुत सारे कैंसर जेनेटिक है, ऐसा है, तो उसके लिए भी हमारे पास बहुत सारे जो मेन जो जीन्स है वो हम लोग को पता है, बट देर आर ऑलवेज सम लो पेनिट्रेंस वेरिएंट. तो अ पॉलीजेनिक रिस्क स्कोर बेस्ड ऑन द प्रेजेंस ऑफ मैनी दीज वेरिएंट्स इज मोर स्ट्रांगली एसोसिएटेड विद अर्ली ऑनसेट colorectal cancer than late onset CRC. Similar phenomena has been observed for breast and prostate cancers. Certain environmental and lifestyle risk factors occurring in early life to young adulthood might make individual carry a higher number of low penetrance risk variant more susceptible to cancer development. So now we'll come to individual cancer. So breast cancer, this is the most common type of cancer in women. 14% of all cancer in Indian women, these are breast cancers. Every 4 minutes, an Indian woman is diagnosed with breast cancer. Breast cancer is on the rise in both rural and urban India. Women in their early 30 to 50, they are at considerable risk to develop breast cancer, and the incidence risk, it increases till its peak by the time they reach 50 to 64 years. In general, if we see, there is 1 in 28 Indian women is likely to develop breast cancer during her lifetime, and 1 in 22 for urban women, and the rural group is 1 in 60. So yes, there is an increased incidence in the urban women compared to rural population. Then breast cancer is most common form. It has overtaken cervix cancer. 50% of cases, they are in the age group of 25 to 50, and that is why that is more important. 70% they present to us in advanced stage, and they have poor survival and high mortality. And the simplest way for prevention is self-breast examination. Women should be doing this on regular basis after they turn 30. Mouth cancer. The risk of developing head neck cancer was 1 in 33 for males and 1 in 107 for females. According to the Globocon 2020 data, there will be 2.1 million new cancer cases in India by 2040, an increase of 57.5% from the year 2020. तो ये एक बहुत इंपॉर्टेंट पॉइंट है कि द इंक्रीज वुड बी 57%. इवन इन हमारी ओपीडी के अंदर हम लोग देखते हैं, जब पहले जो पेशेंट्स आते थे कैंसर के, माउथ कैंसर के, द एवरेज एज ग्रुप वाज मोर देन 50, 55, 60. पर अब हम लोग देखते हैं माउथ कैंसर के साथ आते, दे आर हार्डली 30, 35, 40. So yes, definitely mouth cancer is occurring in early age group because of the changing pattern of tobacco use. So in 1 in 9 Indians, they have a lifetime risk of developing cancer. Now we all know about tobacco, smoking, alcohol as known major risk factors for head neck cancer. But with changing sex practices, HPV is an emerging cause of head neck cancers. Yes, HPV vaccination is important. सब लोग को लगता है कि नहीं, HPV vaccination सिर्फ cervix cancer के लिए important है, ऐसा नहीं है. It is important for both, in males for head neck cancer, anal cancer. So wherever HPV is a risk factor, in that places HPV vaccination is important. So same goes for colorectal cancer. So this was an PEACOCK, Pan-India Early Onset Colorectal Cancer Consortium. So India is the third highest early onset cancer cases, colorectal cancer cases globally, and it is second in the number of deaths caused by it. It is particularly concerning because it tends to be very aggressive and leads to poor patient outcome, and there are no established screening guidelines. जब भी अर्ली एज के अंदर अगर कोलोरेक्टल कैंसर होता है ना, इट इज़ मोस्ट ऑफ द टाइम इट इज़ पुअरली डिफरेंशिएटेड सिग्नेट रिंग्स, एंड द रिजल्ट ऑफ सिग्नेट रिंग इज ऑलवेज बैड. So what can we do about early onset cancer? So there are 3 ways. First, we should know what are the causes. Second, warning signs, and third is screening. So about the cause, so अभी तक हम लोगों ने, we are talking about the new emerging risk factor, not that we know. So breast cancer के अंदर these are the risk factors. Younger age at menarche, oral contraceptive use, nulliparity, older age at first birth, never breastfeeding, central obesity, physical inactivity, alcohol intake, and same fat intake, which correlates with obesity. Then colorectal cancer. So colorectal cancer, the risk factors are obesity, sedentary lifestyle, then metabolic syndrome, type 2 diabetes, hyperlipidemic diet, alcohol, and inflammatory bowel disease. Endometrial cancer, yes, obesity is a risk factor. Esophageal adenocarcinoma, obesity, recurrent GERD, head neck cancer, alcohol consumption is yes there, and HPV infection. So most of you, they don't know HPV infection is a risk factor for head neck cancer, and it is emerging risk factor. Then kidney cancer, yes, obesity, multiple myeloma, obesity, pancreatic cancer, obesity, and alcohol intake. वार्निंग साइंस. सो अब लास्ट 15 दिन में क्या हुआ है कि ना, मेरे पास 4-5 फ़ोन आए. एक 32 ईयर ओल्ड अनमेरिड लेडी डायग्नोस्ड विद अ ब्रेस्ट लंप, USG के अंदर बायरेट्स 3 दिया, एक्सीजन वॉज डन एंड इट टर्न आउट टू बी मेलिग्नेंट. अभी कोई सोचता नहीं है 32 ईयर्स में कहाँ मतलब इसमें कैंसर हो सकता है. देन सेकेंड गोज फॉर 35-year-old मैरिड हैविंग 2 kids, बायरेट्स 4A on USG and excision biopsy malignancy. So yes, so these are all risk factors. What we should these are all common red flags what we should know in our day-to-day practice and how to diagnose. क्योंकि अभी क्या हो रहा है कि कैंसर बहुत जल्दी जल्दी हो रहा है, तो ऐसा नहीं सोचने का कि अपन को 40 साल के बाद ही अगर ब्रेस्ट लंप है तो फिर हम लोग उसको कैंसर डिफरेंशियल डायग्नोसिस में डालेंगे. नहीं, आपको कभी भी अगर ये सब साइंस सिम्टम्स दिख रहे हैं देन यू शुड कंसिडर कैंसर इन द डिफरेंशियल डायग्नोसिस. So for breast cancer, the red flags are a breast lump which is hard, non-tender, not freely mobile, and which is BI-RADS 3 or more. Why BI-RADS 3? क्योंकि ज़रूरी नहीं है सब जगह स्टैंडर्डाइज USG हो. So your clinical findings, they are more important compared to USG. First go for clinical examination, then go for USG, and then go for FNAC or biopsy. Then the other red flags, they are bloody nipple discharge, recent changes in nipple, axillary nodes, and purulent changes on the breast. Mouth cancer, if there is any non-healing ulcer for more than 2 weeks, then you should suspect that it might be because of cancer. And of course, if the patient has high risk feature of taking alcohol or tobacco or smoking, then you should definitely keep differential diagnosis of cancer. Then if there are neck nodes with unknown primary, ulceroproliferative growth in the mouth, if there is recent history of change in voice, there is dysphagia or whitish patch in the oral cavity. For cervix or endometrial cancer, the red flags are bleeding PV, postcoital bleed, postmenopausal bleed. Then colorectal cancer, bleeding PR, change in bowel habit, anemia, yes, anemia. If there is an adult male more than 40, more than 50 with unexplained anemia, always keep in mind to rule out cause of GI bleed. For that you will need to do a colonoscopy or OGD-scopy or a good scan, CT or CT scan. Then there is long-standing fissure or fistula. Why this is important? Because sometimes there is a long-standing fissure or fistula which is not healing. Then you should keep cancer in differential diagnosis. Try to take a biopsy, see for histopathology. If not, then manage otherwise. Then there is esophageal or stomach cancer. The red flags, they are dysphagia, abdominal fullness, bloating, or gastric outlet obstruction. For ovary cancer, mostly it is abdominal fullness, bloating, ascites. That is how the patient presents most of the times. So for screening, this all we know, just we'll go through it. For breast cancer screening, so these are all our recommendation for average risk for general population. अगर आपके पास कोई patient आता है who is less than 25 years, अगर वो बोलता है breast cancer screening करना है, तो yes, आप बोल सकते हो ज़रूरत नहीं है for breast cancer screening. Clinical examination, yes, definitely you can do. From 25 to 40, what the guidelines they recommend is clinical breast examination every 1 to 3 years and breast self-examination every monthly. Then 40 to 50 years, you can consider for mammography. After 50 years, 50 to 75, mammography every 2 yearly. 76 and above, you don't need to screen. Then for mouth cancer screening, the person who is a regular user of tobacco, alcohol, and who has got trismus, less mouth opening, at least you can tell the patient to go for mouth cancer screening by himself or herself only at home. And these are the ways. He has to look for gingiva, lip, buccal mucosa, vestibule, hard palate, tonsil, under surface of tongue, and lateral border of tongue. Yes. So the same goes for lung, prostate, and cervix cancer. In lung cancer, if the patient is high risk, age 55 to 75, 30 pack history, pack year smoking history, and he is in currently relatively good health. Prostate cancer, not everyone needs to do. It has to be discussed in detail with the patient when and where to do prostate cancer. Then cervix cancer, so from 21 to 65 years, screen with cytology every 3 years. From 30 to 65, you can do dual screening of HPV testing and cytology. So colon cancer screening, we can do for average risk individual flexible sigmoidoscopy every 5 years, or with a fecal occult blood test every 3 years, or a colonoscopy every 10 years. So this is my special interest. So अगर पेशेंट आपको पूछता है कि ब्रेस्ट कैंसर के अंदर ब्रेस्ट पूरा निकालना है या बचाना है, so there is now 20-30 years of data that you can do breast conservation surgery. No need to remove complete breast. Of course, it depends upon the patient what to do. And we have completed 4 years now in Surat with these many OPD and OTs. So yes, I am proud that I got support from all of you, and thank you. Yes.
Yeah, very big round of applause says that your lecture was quite informative, sir. We didn't know that antibiotics are also indirectly causing colon cancers.
Yes.
And we even didn't know that HPV vaccine is also beneficial for males.
Yes.
Yeah, thank you so much.
Yes.
I would like to request Dr. Bhupesh Chavda and Dr. Pragnesh Joshi, sir. Please come and felicitate Dr. Amit Gupta.
Just for information, Dr. Pragnesh Joshi, uncle, is my family doctor. We had been seeing him since my childhood, so yes, I have a huge respect for him.
I am just not his family physician, but his father and myself, we used to be very good friends since our childhood.